Got clients that need hip mobility? Hey there, this is Dr. Evan Osar, author of Corrective Exercise Solutions to Common Hip and Shoulder Dysfunction. Welcome to this edition of Integrative Movement Insider. Janice and I are super excited. We've got 2 live conferences coming up. We had to cancel our international travel because of some issues that came up, some pretty significant issues that came up in our lives. So unfortunately, we couldn't make it over to Portugal this year. However, we will make it there next year. Thumbs up for that. However, this year, in the next couple of weeks, we're going to share strategies, corrective exercise strategies for addressing your clients' chronic hip issues. This is our favorite roller, the Rolga. Many of our clients, most of our clients will use this roller prior to doing hip mobility work. However, some of your clients can't easily get on the floor and or use this roller. So regardless of whether or not your clients can use this roller and or get down on the floor, we need to teach them how to use their hips more appropriately. Some of our clients even have hip osteoarthritic changes, significant hip osteoarthritic changes. So how do we work with those clients? There's many patterns that we can use. Did you know that you could actually use your pushing and pulling patterns to actually help drive hip mobility? I'm going to show you 2 examples of how to use cable pushing and pulling patterns. 1 pushing, 1 pulling. 2, show you how to use the oblique chains to help drive hip mobility. As we know, those oblique chains, so the anterior oblique chain, the serratus coming down here into your external obliques, across the abdominal fascia into the internal obliques, and down into the adductor and down the leg. Your posterior oblique chain, the lats on the opposite side, coming across that thoracolumbar fascia to the opposite glute. We can use those chains to create rotation around the trunk, spine, pelvis, and ultimately then the hip complex. And even if your client isn't getting a lot of direct hip rotation, the motion across those chains can help institute more centration of the ball in the socket, or centering alignment of the ball in the socket, and ultimately work your client towards improving hip mobility and ultimately hip rotation. So if we're going to use a hip pulling type of pattern, we're going to use a cable pull apparatus. If you don't have that, you can use a resistance band as well. So what I'm going to do is set myself up. I'll bring my left leg forward. So now my left leg is forward. I have the cable in my left hand. I'm going into split stance position. I always teach my client, long spine, align the ribcage over top of the pelvis, create as much of a pure hip hinge as possible. Then step back with that opposite leg, so that way you know your client is squared up. Now in the beginning, I'm having my client pull towards the forward leg. So the left hand again has a cable, left leg is forward. I'm having them pull and slightly rotate towards the forward leg. So we're driving internal hip rotation on this side. And even if your client doesn't have it, they're still going to get some glute engagement here and engagement of the hip internal rotators through the oblique chains. So this is a great way to start to introduce rotation. Now, if that creates too much impingement for your client, you can also switch it and do it in this split stance, where now the right leg is forward, left leg is back, left hand still has a cable, and now I rotate, and I can start to open up the rotation on the opposite side. So again, here's more internal rotation as I come through the eccentric phase, and more concentric. During the concentric phase, I can get more external rotation of this hip, again, aligning the hip, knee, ankle, and foot. So a great way to use the oblique pulling pattern to drive hip mobility. Now, we can also use pushing patterns in a very similar manner. What we want to be careful of is it's a little more challenging with pushing patterns, but again, it's the same idea. We're using those oblique chains to create rotation. So again, I'm going to grab the cable, set up in a split stance position. So again, right hand has a cable now, left leg is forward. So again, we can use those oblique chains, that anterior and posterior oblique chain. So now we can start to rotate the pelvis. The pelvis is facing towards the camera, but what's going to happen is I'm going to rotate and press, and now the pelvis is facing forward. So here I have external rotation of this left hip, and now I have more internal rotation. So again, going from external, again, the hip, knee, ankle, and foot is aligned, so I'm not allowing that knee to dive in this direction. So I'm using those oblique chains to create this rotation around the hip joint and improving hip centration, the alignment and control of that hip joint. As your client gets more advanced in the pattern, or for your clients that have more advancement in their hip mobility, I will go front leg forward. I should say the right leg forward as the right hand has the resistance. Now this requires a lot more internal hip rotation, but we can again use those oblique chains to help drive internal rotation, which is what most of our clients need. So what we want to do again is the same idea, squaring the pelvis up, still good alignment, head and neck, aligned over the thoracolpelvic cylinder, aligned over the top of the hip, knee, ankle, and foot complex. Now I'm going to rotate slightly. So now if you watch my hand that's on the front side of my pelvis, just above my pubic bone, I'm going to rotate towards the forward leg. So again, I'm getting that internal rotation, hip, knee, ankle, and foot is aligned, and now I drive out. So now I'm driving internal rotation of the hip, external rotation of the hip. Internal, loading up that posterior hip complex, and driving out. So again, obviously the client needs more hip internal rotation, so this is a more advanced pattern. We use this more with our athletes as well to help them drive off that glute. And again, you should feel it, your client should feel it in their glute as they sit into the glute and then come out of the glute and then use those oblique chains to finish the motion. So different ways to use a pushing and a pulling pattern to help drive internal and external rotation in that closed chain setting, which is what our clients truly need to learn how to do. Clamshells and all these things, yeah, they have their place, but they're not helping transfer the ability to rotate and control rotation to align the hip, knee, ankle, and foot in the upright position. So get your clients upright, use your pushing and pulling patterns, even if they have osteoarthritic changes, they have impingement syndromes, we still use these patterns, albeit with modifications. I gave you a couple examples of that right there. I hope that helped. Let me know what your thoughts are about that and how those patterns work out for you and the clients that you work with.